Everybody should have the right to health care because it was once said in the United Methodist Church that health care is a basic human right. Providing the care needed to maintain health, prevent disease, and restore health after injury or illness is a responsibility each person owes others and government owes to all. A responsibility government ignores at its peril. And like what my partner said, in the Declaration of Independence, it is said that we hold these truths to be self-evident, that all men are created equal and that they are all endowed by their Creator with certain inalienable rights, that among these are life, liberty, and the pursuit of happiness. Now that term life includes the preservation and protection of that life, or one's right to stay alive or continue living, which means that government should require the access to healthcare and medicines to be keeping somebody alive and not just leave them to die just because one cannot afford it. One of the problems with healthcare in our country right now is that most Americans have the perception of the country's healthcare to be negative. Most of these negative feedbacks comes from the uninsured. There are a total of 47 million uninsured, according to the U.S. Senator James Risch. From these 47 million, there are 11% of legal immigrants, 11% of illegal immigrants, 13% eligible for employer-sponsored insurance, 19% individuals earning more than $75,000, 20% eligible for government programs, 26% Americans without affordable option. That's about 15% of our population, and it is important that we find ways to help those who need and want insurance but cannot afford it. Healthcare today is also unaffordable for businesses and individuals because less money is going back to the economy since businesses are spending more money on health insurance, which means that they will have less money to spend on raises, new hires, and investments. Also, less money is going back to the economy because of the individuals who are spending more money on health insurance rather than rent and food. Therefore, healthcare prevents the country from making economic recovery. If the government provided universal healthcare, costs would reduce and would help to recover the government. People would have an easier time starting their own businesses or working part-time if health insurance was covered because many people with full-time positions have the fear of losing their health insurance or the fear of paying an enormous amount of money per month or for health insurance. Some people with kids with expensive health conditions cannot really leave their jobs either. If universal health care was provided, people would be able to work part-time so they can spend more time with their kids or doing some other things, so it's not all about work. Business people who want to start their own businesses will not be able to do that because they cannot afford the startup costs and risks if health conditions is added in. How can someone take risks and better themselves if they're always afraid of getting sick and losing everything? If there was universal health care, it would provide these opportunities to those people. Universal healthcare would also allow medical professionals to concentrate more on healing the patient rather than insurance procedures, liability, etc. Doctors now must take classes just to simply understand all the insurance that's out there. They are often restricted by insurance practices, such as what tests can be ordered. They must also practice defensive medicine to avoid getting sued. There are actually doctors who are leaving their profession just because they don't want to deal with these non-medical headaches. A universal health system would allow medical professionals to simply focus on what's best for the patient instead of insurance because medicine is already a complex enough subject as this. They don't need to worry about something else that's not related to medical. Another problem right now with our current health system is that patients with a past or current medical conditions such as cancer cannot obtain affordable health coverage. Some insurance companies do not cover that because it is an expensive illness. This means that these type of patients will either have to use up all their own money or leave the condition untreated. In a universal system, no one with pre-existing conditions should be denied coverage. People could change jobs without fearing the loss of health insurance. To respond to my opponent's point that he rather risks bankruptcy, I don't think so, because nearly 2 out of 3 bankruptcies comes from medical bills. A new study shows that people with health insurance faces financial disaster if they experience a serious illness. In 2007, medical problems contributed to 62.1% of all bankruptcies, according to the published online Thursday after in the American Journal of Medicine. Among families who were bankrupted by illness, those with private insurance reported average medical bills of $17,749, compared to those who were uninsured. who face an average of $26,971 in medical costs. Of these medical expenses, it includes prescription drugs, doctor's bills, insurance premiums, and medical equipment that's being used. The United States spends more than $2.2 trillion on healthcare each year, approximately 16% of the total economy. The high cost of healthcare causes a bankruptcy every 30 seconds. By the end of the year, it will cause 1.5 million Americans to lose their homes. Another point that I also want to respond from my opponent's claims is that it is not true that preventive care will be more expensive, because if there was universal health care, it would improve public health, because free medical services would encourage patients to practice preventive medicine and find health problems, while treatment will still be light, so that not many medical services are being used, which means that it will not cost a lot while treatment is still light, rather than going to the ER or when you find out that your treatment is serious because you've never had any preventive care. Currently in our society, patients often avoid physicals, mammograms, HIV tests, and etc. to prevent getting major health problems, so that health problems can be caught at an early stage. This not only affects the health of the patient, but the overall cost of the system, since preventive medicine only costs a small fraction of the full disease. Universal health care would allow the patients to look into free medical services and preventive medicine instead of visiting a medical professional or the ER every single time, because the cost is way too expensive. If preventive things were done before a serious health problem, it would end up saving a lot more money from people's pockets.